नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is edema and its pathogenesis. Pathogenesis of edema. Edema is caused by mechanisms that interfere with normal fluid balance of plasma, interstitial fluid, and lymphatic flow. The following mechanisms may be operating singly or in combination to produce edema. First is decreased plasma oncotic pressure. A fall in the total plasma protein level, hypoproteinemia of less than 5 gram per deciliter, mainly hypoalbuminemia, result in lowering of plasma oncotic pressure in a way that it can no longer counteract the effect of hydrostatic pressure of blood. This results in increased outward movement of fluid from the capillary wall and decreased inward movement of fluid from the interstitial space, causing edema. That is edema of renal disease in nephrotic and nephritic syndrome, ascites of liver disease in cirrhosis of liver, and edema due to other causes of hypoproteinemia, that is in protein losing enteropathy. Second is increased capillary hydrostatic pressure. A rise in the normal hydrostatic pressure at the venular end of the capillary, which is normally low, average 12 milligram mm of Hg, to a level more than the plasma oncotic pressure, result in minimal or no reabsorption of fluid at the venular end, consequently leading to edema. Examples are edema of the cardiac disease, that is in the congestive cardiac failure, constructive pericarditis. Second is ascites of liver disease, examples in the cirrhosis of the liver. Passive congestion, examples is in mechanical obstruction due to thrombosis of vein of the lower leg, varicosities, pressure by pregnant uterus, or tumors. Fourth is postural edema, that is transient edema of feet and ankles due to increased venous pressure seen in individuals whose job involves standing for a longer hours, such as traffic constable and nurses. Third is lymphatic obstruction. Obstruction to outflow of these channels cause localized edema known as lymphedema. Examples are removal of axillary lymph nodes in radical mastectomy for carcinoma of the breast, causing lymphedema of the affected arm. Pressure from outside on the main abdominal or thoracic duct, such as due to tumors, effusions in serous cavities, etc., may produce lymphedema. Inflammation of lymphatics, such as in seen in filariasis, infection with Buergeria bone-crafty, result in chronic lymphedema of scrotum and legs, known as elephantiasis, a form of non-pitting edema. Occlusion of lymphatic channels by malignant cell may result in edema, or Milroy's disease or hereditary lymphedema is due to abnormal development of lymphatic channels. Fourth is tissue tension. In some situation, the tissue factor in combination with other mechanisms plays a role in causation of edema, that is elevation of oncotic pressure of interstitial fluid as occur due to increased vascular permeability and inadequate removal of protein by lymphatics. Lowered tissue tension as seen in loose subcutaneous tissue of eyelids and external genitalia. Fifth is increased capillary permeability. When the capillary endothelium is injured by various capillary poisons such as toxins and their products, Example is histamine, anoxia, venom, certain drugs and chemicals. The capillary permeability to plasma protein is enhanced due to development of gaps between the endothelial cells, causing leakage of plasma protein into interstitial fluid. Examples are generalized edema occurring in systemic infections, poisoning, certain drugs, and chemical, anaphylactic reaction, and anoxia. Localized edema is a few examples are as under. First is inflammatory edema, as seen in infectious allergic reactions, insect bites, irritant drug, and chemicals. It is generally exudate in nature. Angioneurotic edema is an acute attack of localized edema occurring on the skin of face and trunk and may involve lips, larynx, pharynx, and lungs. It is possible neurogenic or allergic in origin. Sixth is sodium and water retention. It is best described in relation to normal mechanism of sodium and water balance. Intrinsic renal mechanism is activated in response to sudden reduction in the effective arterial blood volume, hypovolemia, that example in severe hemorrhage. As a result of this, renal ischemia occur, which causes reduction in the glomerular filtration rate, decreased excretion of sodium in the urine, and consequent retention of sodium. Extrarenal mechanism involves the secretion of aldosterone, a sodium retaining hormone, by the renin-angiotensin aldosterone system. Angiotensin second stimulates the adrenal cortex to secrete aldosterone hormone. Aldosterone increase sodium reabsorption in the renal tubule and sometimes causes a rise in the blood pressure. ADH mechanism. Retention of sodium leads to retention of water, secondarily under the influence of antidiuretic hormone or vasopressin. Thus, the possible factor responsible for causing edema by excessive retention of sodium and water in the extravascular compartment via stimulation of intrinsic renal and extrarenal mechanism, as well as via release of ADH, are as under. A reduced glomerular filtration rate in response to hypovolemia, enhanced tubular reabsorption of sodium, and consequently its decreased renal excretion, increased filtration rate, that is, increased filtration of plasma from the glomerulus, decreased capillary hydrostatic pressure associated with increased renal vascular resistance. The example of edema by these mechanisms are as under: edema of the cardiac disease, ascites of the liver, edema of the renal disease. This session is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.